ask Governor Pataki a question, and Governor Weld, you can jump in also, because once again, I'm so tired of the party of no. This is an imperfect bill, and as Mr. Brokaw just pointed out, obviously some good things are taking effect. So instead of saying what's wrong with it, Governor Pataki, please tell the 40 million Americans that are getting insurance now, please tell me that kid who has asthma who's finally getting it, the unemployed kid, please tell me what you would do to reform health care. Stop with what's wrong. Please give me 5 specific things that do not destroy this country, that do not put us backwards in the deficit, and make our health care system better. Please be a party of yes.
I'll give you the 5 right now, Donnie. And you're right that we do have to not just be critical of what is happening in Washington, but offer alternatives. First of all, we can lower the cost of health care by having true medical malpractice reform.
Agreed.
The Democrats stayed away from that, and it can save us billions of dollars, and they did it to protect the constituency that donates. Second of all, we can allow people to purchase across state lines. If you prefer a company or the package of policies and programs that are offered in a different state, why can't you sign up for that? Create a broader competitive market that crosses state lines. Third, put in place health care where you have health savings accounts, so you can follow the model that many companies have used, where they have comprehensive health care coverage that has a high deductible, but that deductible is offset by a health savings account where the actual consumer of the health care services, people, make the decision when they're going to utilize the services. 4, put in place some of the very good things that are in the bill, like pre-existing conditions and lifetime caps. And 5, undo the taxes that we have are going to be suffering under this new health care bill, and some of those times start immediately, and instead put in place that are going to incentivize the entrepreneurial part of our economy to create jobs and growth so we can fund our health care program and create jobs.
Governor Pataki, the last issue just walks right in the wrong direction of the deficit. What Joe talks about all the time, which I agree. All of a sudden, how are we going to pay for these things?
No,
it doesn't. Tax more people.
Donnie, I went through this when I was governor. We had a massive deficit, and everybody said you had to raise taxes. And I said, no, we could cut spending, lower the tax burden, grow the private sector, and in the process create more jobs and generate more government revenue through a more vibrant private economy. It happened. It worked. You can do it in Washington.